Good day, everybody. Thanks very much for having me here. I'm from a company called Research2Guidance, and we are not app developers, but we are very, very interested in the health and digital health area since many, many years. We are the guys who wants to provide insights into the markets, who wants to help you with the business cases, and with finding the right partners. We are somehow what you would call in the early days, you would call the guys who sells and provides the shelves and the tools for the gold diggers to dig into the gold mines and find the gold mines. I want to talk about a research program today which we conduct since 2010. It's an mHealth economics research program, so it's all about how to make money in this market and who's successful and how they are successful. And it's a truly global program. We analyze and we talk to thousands of mHealth companies, be it big ones or small ones, every year, and then we want to give something back to the community with the help of our reports. And, with the help of our reports. And you're invited here to have a look at them. So the interest in digital health has increased over the years, and we see that by the number of people downloading summary reports from our website. So it's a good market to be in. It's a good time to be in, but it's already getting crowded. And so you're not alone, which is on the one hand side, it's a good thing. So the ideas you have in here, they are not so crazy that nobody else is thinking about it. But we see, especially in the last 2 years, we see really a growth on the supply side, which is determined by number of applications and the number of publishers being active in the market, which outnumbers the number of the growth on the demand side, which you can see when you look at the download numbers. This all led to quite a substantial number of publishers. So we talk about 58,000 mHealth publishers, so you're really not alone. And 250,000 mHealth related applications in those major application stores, and 3 billion downloads in 2016. But it's a difficult market. That's a no-brainer to say. And we also asked the companies, did you reach your goals yet? And the vast majority has not reached their goals yet, which might be okay for startups, but it's not okay for companies which are being active already since many, many years in this market. And one of the reasons is also that they don't generate enough reach in terms of downloads to start with. So more than half of the applications, they generate less than 5,000 downloads per year with their entire app portfolio, and they generate less than $10,000 of revenues with their total portfolio. The search for the good business model is really omnipresent in this market. Everybody tries to do something and make money with something. So there is no real number one revenue source for the companies in this market. If you compare that with the game industry, for example, then it's really, it's a totally different picture. You have 90% making their money with in-app purchase and in-app advertisement. But here, everybody is looking for, can I do some licensing deals with health insurance company, or we also find a lot of companies doing development work to sustain their business. So it's difficult, but what do we see as what constitutes a best-in-class application for medical purposes? So first of all, it should be and it must be a beautiful app. So the time is definitely gone where you publish an application it's a data dump, or it's looking more like a medical device. So pay much attention here to how the application is looking, because you compare and you compete with games and social media applications on the screen of the device. Then we think, because you never get closer to somebody as with the help of an application sitting on a smartphone, because the user is using it 24 hours, 7 days a day, 7 days a week. So therefore, we would think that the application should concentrate on tracking and self-empowerment of the user while he's carrying the device. Then, obviously, try to automate the data input as much as possible. And there are lots of APIs out there. There are lots of sensors out there to connect, to facilitate a data input. And then the fourth point is very important. Provide access to coaches and HCPs. That's so important, and I will talk about it a bit later. Save data, and that's a no-brainer, especially if you want to work together with health insurance company. It's more proving that the processes are in place to secure that everything is safely stored, communicated with the help of your application. Then, whenever possible, to allow HCPs here to use your application, try to connect with the existing platforms they use. Don't force them to use your own web portal to benefit from your application. So integrate with the existing systems as much as possible. And then, lastly, but very importantly, never let the user be alone. Try to open up communication channels with peers, which is very important, or relatives, to let the user think, okay, I'm not alone. I might have a chronic condition, but I'm not alone, and the application helps me to connect to somebody else. So, user attention is really a big thing here, and if you want to help the patients, then you want to change the behavior. That was something which was mentioned earlier on already. But how do you do that? The good thing is that there are lots of tools and features you can use. The bad thing is that there is no silver bullet. So this is what you see here is a list, or as a matrix of services or feature you can implement into your application, and based on the experience of thousands of mHealth app developers, what they think, how easy they are to be implemented and how effective they are. And what you see here is that the connection to HCPs, to coaches, to doctors is the best method to keep the user engaged and retain, and to help them to change their behavior. There are other forms, there are other features which are being implemented more easily, but the most effective one is the reach out to a person, to a coach, whenever the patient needs it. So we also ask, okay, what is the best distribution channel for getting your application out to the users, be it the HCPs or be it the patients? And this curve really is what we call, it's the hype curve of the mHealth app market. Because when we started asking the mHealth app publishers, 2010, what will be the main distribution channels in 2015, they thought, oh, it's going to be integrated and doctors will recommend it, and hospitals will make use of it. And app stores, no. App stores, they won't play a major role. But see how the curve of the app stores went up over the course of the last few years, and the curves of the traditional healthcare providers went down. So there is, the hype is still there, but people are realizing that going through the channel of making the doctor prescribing it or making the hospital using it will be a very tough one in the next few years. Platform, you think that's an obvious thing, that the two main platforms are the number one mHealth's publishers are working on, but if you look at other segments of the market, then this really is interesting for us, that it is such an iOS-driven market compared to all the other ones. So we see a lot of applications, which are just being released on iOS. That changes now, but if you look at the distribution potential provided by Android and compare that with iOS, you might think that maybe there has to be a shift in the market as well, and that you have to see Android in a clear lead position in the next 2 years. Diabetes is clearly the #1 chronic condition. mHealth's publishers think, okay, that's a chronic condition where our application will provide beneficial services, and we can make some money out of it. And that lasted already over years. And we have done extensive studies on diabetes as well, and we see that the adoption within the people suffering from diabetes has started to take off. So that's a good sign for everybody who is engaged in diabetes now. Okay, if you want to reach out to mHealth's publishers as you are and startups, there are lots of ways of doing it. And we talk a lot with health insurance companies, pharma companies, and they ask, okay, what is a good way of doing it? And I mean, this platform here, like Rockstart, it's an excellent way of connecting with innovative, what we call the promising prospect companies, which might have a future in the next few years, and which got great support by Rockstart to do the first 1 or 2 years. But then there is what we call the hidden champions, which have already proven that they got some users and they retained the users. This is something, it's a very, very small and tiny group within those 250,000 applications. And we think those applications, those companies should be addressed directly. That's about it. I hope that was interesting for you. I'm happy to answer your questions. Thank you very much.
Okay, thank you, Ralf. Please join us a little bit on stage. We have this system here called Busmaster.
Yes.
And Busmaster will basically define the questions. And we have this throwable microphone. I don't know where that one is gone. Right now it's there. Okay, thank you. But you said something very interesting in a small sentence at first. You were the providers of tools for gold diggers. And that reminded me of a time